Well, phase one of the reopening plan in Ontario will allow curbside stores, dog groomers, tennis courts, and car dealerships to open under some strict guidelines. But some are asking if the move is happening too soon. We spoke with an epidemiologist to get his take, and while he would have liked to see the province wait until the number of tests coming back positive was down to 1 or 2%, while right now it's at about 5%, he says there are ways we can stay safe as we slowly start to venture back to business.
Think everything's okay, we can go back to normal, which is not true. On the other hand, you have people who think everything is horrible outside and nothing is safe, which is also not true. We have to find a comfortable middle ground because this is the new normal for the next few months, possibly years. And we can't live in panic and we can't fear our fellow citizens. We have to understand that the risk to individuals remains low. So what I expect to see as businesses open is taking, in particular, the physical distancing seriously. That's going to be key. That's the most important element of this public health control. And after that, if you cannot physically distance, I believe masks should be almost mandatory in situations where you must work in close proximity.
When we do look at what has been opened or allowed to open, is there anything that jumps out at you as kind of a concern?
Well, the ability to hire workers in your own home is a little troubling. You can't control their level of exposure to possible infection, and therefore you're exposing yourself to that infection as well. So what I would like to see is for those people to have additional protective gear, like masks. As well, you can also ask people to be extra diligent in their personal lives. Obviously, you can't guarantee that they will, but you can select your employees and your workers based upon the extent to which they take things seriously.
Can we look to any other scenarios, cities that have reopened, to see the do's and the don'ts? What can we learn from them?
Well, the American examples are not good examples. They are fairly flagrant with their distancing policies, and people there very often are not taking it seriously. It doesn't take a lot of people to ruin the soup, as it were. So our better role models are places like South Korea and Taiwan, who have a pretty good grasp of things. Now, South Korea had an outbreak recently, and that made the news. One individual went into a couple of nightclubs and started an outbreak of about 100 people or so. That's a big deal. I take away from that, though, that they were able to trace individuals in South Korea from that one individual. They had the public health infrastructure in place, and they were able to contain the scenario as much as they can and prevent a second wave from occurring. Do we have that capacity here? No, we don't.
Now, Dr. Dionandin says until the government is able to ramp up testing and contact tracing, we can do our own part by keeping track of our own movements so that it's easier to trace your steps if you do contract the virus. Now, he says the goal here isn't to eradicate the disease, but prevent outbreaks and epidemics.